Hi, I'm David Bernstein. I'm an orthopedic surgery resident at the Harvard Combined Orthopaedic Residency Program in Boston, Massachusetts. And I'm thrilled to have Dr. Selina Poon, a pediatric orthopedic surgeon who's trying to save the world, one patient at a time and one paper at a time, as you'll see here, join us on today's Gladden Society Research Spotlight. Today, we will be discussing Dr. Poon's article, Race, but Not Gender, is Associated with Admissions into Orthopedic Residency Programs, a recent study published in Clinical Orthopedics and Related Research. Dr. Poon, it's a pleasure to be with you today.
Thank you for having me.
Of course. So if you don't mind, tell us a little bit about what led you to undertake this study.
Yeah, I think there's a very common perception in the medical students as well as in orthopedic attendings that it may be easier for women to get into orthopedic surgery because there's so much focus on gender diversity in orthopedic surgery. Personally, I didn't think that was the case based on my own experiences many eons ago, and from my interactions with the residents and the med students and interviews. And so, as a true nerd, I was like, well, the data has to be out there. So I went into a deep dive and couldn't find any. But what I did find was data from AAMC. And so we looked at that data and we found that orthopedics in the last 10 years or 15 years has been very low in terms of women and gender and ethnic diversity. And so we were like, so the next question was obviously, why is that? Is it because are we accepting lower amount of women, and that we are accepting a lower amount of underrepresented minorities because their credentials are different? Is it because the step scores are different, or is it because they have less research? What is the reason?
Right.
And so AAMC will provide that kind of data, but NBME owns the step 1 and step 2 data. So we initially asked AAMC for the data, and they were more than willing to provide it. Mm-hmm. But they did ask us to ask NBME for the step 1 and step 2 data, which we then just went ahead and in my ignorance just asked for it. And I think I was just very lucky, and they were like, okay, we'll give it to you. And so that's where this all started. Just a simple question. And that's how this whole project, or 4 years, started for me.
Fantastic. And then after getting all of that data, clearly it took a lot of work to run the analysis and write the manuscript. What were the core findings that you discovered upon completing this project?
So based on this data set, there was 3 papers. There was one that showed that women and men, applicants and accepted residents were relatively the same. There was not much difference in their credentials. There is significant difference between the actually all minorities and in terms of their application credential. But this last paper that we really wanted to talk about was what are your odds of getting in based on your step 1, step 2, and then gender and your ethnicity. And so I wanted to prove that it wasn't easier for a woman to get into orthopedic surgery. What I found was that, yes, it was not easier for a woman to get into orthopedic surgery. However, the surprising finding is that if you were at any kind of minority, your odds of matching into orthopedic surgery was lower than a white person. And so that was literally this paper.
Yeah, absolutely. And it's both disheartening, but it's also something that I think that we can take and try to address, and knowing the information and actually having this data and these findings is an important first step versus the discussions that you alluded to earlier of, well, we think this or we may know this. This shows that the data doesn't lie. And so now we have a mission to try to address this in order to make our fields more diverse, more inclusive, and better for everybody. And so as the author of this truly remarkable paper that for anyone watching, I feel that it's a truly a must read in orthopedics education today. What do you feel moving forward? What can be done? What should be done? What are next steps?
I think, oof, trying to, um, as now that we know that, right, we've always had ideas. Maybe this is happening, maybe that's not, but now we know. There's no more hiding behind, maybe it's because their scores are lower, maybe because they're not doing, they don't do enough research, maybe because they don't volunteer enough, and all these things. So most likely is because of the implicit biases that we all have. If you look at orthopedic surgery and those who are at the top, it's all white men. And so who are the people who are interviewing these residents and or applicants? It's going to be a lot of white men. And so being a powerful voice in that room is going to be very important. And so we need to think about that. One, we need to figure out what our own internal biases are, whether it's implicit or not. And you have to invite the appropriate people into that room and listen to their concerns and what they're saying when we're selecting residents, right? So I feel like for the residency selection process, the true kiss of death is after we've interviewed everybody and we sit in that room and we discuss each resident and we start putting them on our rank list. The kiss of death truly is that kid going to fit into this resident, right? There's no arguing about that. But if all of us look the same, and then no, that person, that diversity resident, or that black med student, or that Hispanic resident, or that woman is not going to fit in because he or she does not look like any of us in this room. So I think that's the difference. I hope people are starting to think about that. I hope this brings people to kind of take the implicit bias test that's available online and work to learn more about why this is important.
Right. Absolutely. I think those are crucial first steps. And clearly you're a distinguished leader in this area and in this field. And it's been a pleasure kind of hearing your work in this specific paper, but also I know there are many, many papers that you've published and editorials that are really just critical readings as we try to make a difference in this field, and really for the field and for the patients that are served by our departments kind of across the country. So it's really been a pleasure speaking with you, Dr. Poon. We look forward to seeing kind of all that you're going to continue to do in this area. And hopefully we can make a difference, and a follow-up study in the future will show a difference, which would be truly remarkable and indicative that change driven likely by this paper and others and discussions made a positive difference in the world. So a pediatric orthopedic surgeon saving the world, and this is certainly kind of how to start. So thank you, Dr. Poon. It's been a pleasure.
Great. Thank you so much.